Hello, everyone. Welcome to the new ANF Academy interview. Today, I'm talking to Yaman from Saudi Arabia. He is a doctor of physical therapy. Hi, and welcome to this interview. Let us
Thank
know
you.
when did you join ANF education and what expectations did you have?
Actually, I was introduced to ANF about 3 years ago, but I was not available at that time to join because I was doing my doctorate degree. So one of my students, Walid, actually from Saudi, he joined the ANF about 2 years before me or so. And I joined in the beginning or the end of 2020. When I joined, I took the free course, which is like the pain mastery. And I was really impressed with Dr. Michael and Irina and all of the staff and the way they were talking and the confidence that it really works when nothing else works. And I graduated from a physical therapy school in 1988. So I know with all of these years, we have some challenging patients that they don't improve actually with physical therapy or medication. And I have heard about ANF that it really works with those cases. And that was actually the biggest attraction from my side to join ANF this late in my life, I would say. And actually, I am so impressed and I'm so thankful that I have joined. And actually, I finished all of the courses, not the holistic yet, but hopefully next year I will continue definitely with the holistic courses.
You said that you as a physical therapist, sometimes you cannot help with every kind of condition or type of pain without ANF. Is that, maybe I misunderstood?
No, that is
what
true.
Kind of cases you wouldn't be able to help without the help of ANF?
Well, I had so many patients with fibromyalgia, neuritis, other conditions like frozen shoulder, especially if the patient has severe diabetes, that those patients were always a challenge for, I think, every medical practitioner. I had 3 sisters who were fibromyalgia. I think it's a part of their lifestyle, or I think it's genetic or something, because the whole family has fibromyalgia. And I have seen miracles with those patients with ANF, that I tried everything in the past with the same patients with no improvement. I have tried ultrasound, I have tried laser, I have tried electrical stimulation. I mean, it was all temporary and then it goes back. And then I knew that in medicine, there is nothing that you can offer those people. With ANF, I have those people, they can witness to what I have said. And one of them described her case as, I've been in hell and I moved to heaven with ANF. So this is like a great statement. And she mentioned that so many times. And she is like telling everybody around. She is actually the main source of my other patients who are coming to the clinic.
Actually, most ANF practitioners, they do not invest in marketing. It's usually patients that say how that therapy helped them, and then other people come.
That's true.
Word of mouth. Yeah,
that's true.
But you said that you can help patients with diabetes or fibromyalgia, but how can you, as a physical therapist, and this is orthopedic course, so that means the spectrum of conditions and diseases that you can help with ANF is quite big.
Well, ANF actually, it's a whole era of medicine. I'm not saying it is specialized in ortho cases, neuro cases, or anything. I tried ANF.
Our program.
Yes.
Later comes holistic, but
yeah,
for now it's orthopedic.
Yeah, well, it's ortho-neuro. So actually, fibromyalgia is part of it. I really don't care about titles. As long as I can help my patients, I'm happy. The principles are there. If you understand the principle, then you can actually choose from those medical devices And actually, you can help almost every person that comes through your clinic. I have tried so many different cases that it's, for example, I did on myself for my glasses. I could see you now without my glasses, and I see you better with the glasses. In the past, I could not even take my glasses off my face for a minute. I used MF2, which is mental focus, and I used energy discs on my sides of the head, and it really helped me so much with my vision. I think if you know the principle, it does not matter how you classify your patient's disease, you can actually always almost, help them to the best or better, let's say, than any other options out there.
What usually your patients say about ANF?
They have to say a lot of good things about ANF and how ANF actually helped them after trying everything else. Actually, I send you an interview with a doctor who is actually a consultant family physician. He is diabetic and he is my patient himself. He came to me and he said, I tried everything. And his arm will not move more than 90 degrees. And you will see that in the videos.
فزي ما تكلمنا عن موضوع اللصقات هذه، أنا ما كنت صراحة عندي خلفية فيها أو حاجة. الله يعطيه العافية الدكتور يمان وضح لي الموضوع كامل، إنه هذه اللصقات تحسن من موضوع المشكلة اللي عندي التجبس. عملنا أول جلسة صراحة كان الفرق تقريبا إلى 60% إلى 50% كان موجود الفرق. يعني بديت أفتح الكتف بدل ما كان زاويته ضيقة بدأ يفتح معايا إلى أعلى. عملنا الخطوة اللي بعدها الجلسة الثانية تقريبا بعدها بأسبوع، كان ما شاء الله تبارك الله في تحسن ملاحظ. بصراحة أنا من صراحة من دحين صرت من الناس اللي عشاق هذا الموضوع ANF، لأنه خلاني فترة وجيزة كنت سويت تقريبا بالعلاج الطبيعي الروتيني العادي 7 جلسات أو 6 جلسات ما شفت أي فائدة. جلستين من هنا اختصر لي الموضوع.
Frozen shoulder actually, it's a big injury that could come from so many reasons. It may start with as little as tendinitis of the muscles around the shoulder joint. It may start as a trauma. It may start. You have to know that taking good history from the patients. The biggest part actually we have learned with ANF is how to palpate and see what nerve actually is involved and is inflamed. And when you know the root cause of that problem, then it does not matter if it is frozen shoulder or if it is neck pain or if it is shoulder pain or whatever. You have to find the root cause and then you can treat from then. It does not matter if frozen shoulder is not a diagnosis by itself to me. It is actually a result of so many other things that are involved in that injury. So what we do, we evaluate the patient, we palpate every single inch of that patient's shoulder, neck, chest, back, upper back, and so until we find that specific inflamed nerve or 2 nerves or 3 or whatever, and we deal with them. So the first regimen, I would start always with pain and inflammation, including also antioxidants and blood flow and circulation. And we go from there and move to a deeper tissues until we finish the whole injury. The idea is every patient is different. So some patients, they have like acute inflammation, others have chronic inflammation, others have edema with that. So the ANF offers actually a whole variety of devices that helps in every single symptom and sign that you find with your patient on a specific depth that you are dealing with in that specific injury. So I would say this is like a whole pharmacy. So you cannot say which medicine that works for that specific disease. There is no one, single medicine for that. So actually, it's a combination.
They're not general protocols. You need to adjust it to every patient.
That's true. Yeah. It is patient specific, and it has to be. I think medicine should not be one size fits all at any time.
Agree. What did you learn through ANF that no other education or therapy have showed you or teach
Actually,
you?
I am so thankful to my teachers in the ANF Academy. I used to teach anatomy and physiology in the past. I have taught in the US and taught in Saudi, and I do so many educational courses. But I have learned in depth how to palpate every single nerve and every single layer. Actually, palpation skills is like it's a mastery in the ANF Academy. And I will really recommend that to every single practitioner, doctors, physical therapists, whatever people out there helping patients to go and learn, or they can learn wherever, over the internet or so. But I have learned so much skills in the ANF Academy and a new way of looking at the patient in a holistic. Physical therapist tends to look local into orthopedic injuries in particular. But sometimes, a shoulder pain that could be radiating from, your gallbladder or somewhere else. So you have to trust your palpation skills and not a referred pain.
So if you didn't join ANF, you would also treat that pain locally. You wouldn't think about involving organs.
True, because physical therapy modalities and physical therapy exercises usually concentrate on a local level of injury. Yes, we evaluate the whole body, but we don't look into referred pain. And if referred pain from a gallbladder, that's not in the scope of practice for physical therapists. With ANF, it gives you an idea that something else is needed to be looked at, and it's a little device that you can put on the liver or so, and that helps with shoulder pain too. So evaluation skills with the ANF Academy were actually improved my own skills to a way higher level, that looking into other issues beside just the local area of pain. I actually loved the academy from day one when I joined. And matter of fact, the biggest part I love about the academy is the family feeling. And it is really not just a college that you get in and get out. It's actually a family and friends who are, I think, to me, they are going to be my friends forever. So this is, if I would say the best part, this is the best part. The other part is the continuing education. The education in the ANF Academy does not stay and stop after you graduate from there. It's actually courses after courses and discussions after discussions, and consultations are open all the time. And you can talk to Dr. Mikkel or Irina at any time. You can write them. And those are our teachers who are so humble and so open to any suggestion and any questions. So actually, the continuing education is the biggest part after the education that you get from there. So it's a whole different experience. See, I have master's degrees and I have doctorate degrees, and I have so many other, honestly, diplomas and stuff in my life. I never seen this kind of really experience in an educational entity that really follows up with you. Like, okay, that's, you are now talking to me after I graduated so many months ago to make an interview. And that's by itself, actually, it tells me that we are family of ANF. We are not just a group of graduate people. Like, for example, I graduated from one big university in the US, and after graduation, I never heard from them. I did my doctorate degree and my research is there and everything. And I mean, it was a great experience, but there is no follow-up family-like, environment as I have seen. And actually, last time when I was in Marbella, they told me, "Do you think you're going to be coming back?" I said, "No, I think I have to." I really enjoy it. I said, of course I will. And, honestly, wonderful people, wonderful staff. I cannot say enough of good things for the whole staff over there. If I will say anything, I really miss every single one of them now. And I wish that, we will meet, and I am sure we will meet again so many times.
But ANF is also community, and what a lot of practitioners love about it is that they can rely on each other. If they feel stuck with a certain case, they ask for help. Not just your teachers, they also ask for help from a peer. So did you have a similar experience?
Honestly, we have very good team. In my clinic, I convinced actually 3 other therapists to join ANF. And yes, we discuss every single case together actually. And we interact all the time. I consult with Walid sometimes, and I consult with Irina in other times, and I consult with Dr. Mikkel, Florin from Romania, and we all talk all the time. They send me, questions, and I send them answers, and vice versa. And we discuss cases all the time. Actually, all of the students who went with me to Marbella, we become close friends than just, classmates. So we are still in connection and very, very good friendship. So yes, definitely ANF. If I have any question or any case that is not showing improvement, I will put it on the forum, and I will get an answer within like hours sometimes, and sometimes like within 1 or 2 days maximum. I will get a very, very detailed answer, and like tons of experience of people all over the world writing me about, similar cases. Yes, definitely there is a whole different practice when you join ANF Academy.
Do you have a favorite ANF device? And if yes, which one and why?
ANF devices is like my children. I don't know which one is most favorite. I think all of them are, but I think for my kind of practice, we always need antioxidants, and we need pain and inflammation. So if you will ask me what's my favorite, honestly, it's hard to decide because you will need a combination. I think ANF devices, same like ANF Academy. You cannot separate one of the others.
But there are several. For example, mental focus, it can work by itself. But when it comes to treating pain and conditions, yeah, I totally agree. You cannot apply only one.
Yeah. But honestly, with the lifestyle of people nowadays, I think anti-stress could work for everybody too. Melatonin is deficient in every single person on earth, I guess. If you are taking every single one of them and decide which one is better, I don't think it's a fair comparison. You cannot say this apple and this orange, which one is better? Well, it's different.
Yeah,
so
agree.
all of them are great. Honestly, I have seen very, very good results, and I use all of them.
Can you help in strengthening the immune system with ANF devices?
I do that to my own family and myself and my patients. The general protocol for immunity is actually just increasing those antioxidants to be sure that there are enough resources for that patient to heal itself. The problem is, I think I did not have, let me talk about myself. I did not have enough information about the importance of antioxidants except through supplements. But I knew now that supplements don't work. And if it works, it's a very, very minimal scale. I do have a device that you can put, and it actually improves the production and the realization and the accumulation of resources in your own system by your food and your intake in general. And it's all natural. It has no chemicals. It has nothing. Actually, it's renormalizing your body to utilize what you have. Otherwise, I would say a lot of patients here in Saudi, or actually people let's say in Saudi, they have stagnation of lymphatic system because they don't drink a lot of water, and it is very dry and very hot in certain areas. And I could see that is very compromising to immune system, to circulatory system, to the lymphatic. I have seen so many patients with lymphedema and lipidemias and so forth. And I think it's a lifestyle change before it's just ANF device. And I think if ANF will ever fail one day on one patient, because that patient did not understand the depth of his problem, and this is a lifestyle change beside the treatment itself. You cannot just go and put devices on everyone who is not willing to drink water, for example. You know,
and decrease sugar intake.
Yes, exactly. I have this dentist, unfortunately, he is a dentist too, who drinks 3 liters of sodas. And I told him, I said, well, how much water do you drink? He said, water. I said, yes. He said, none. He said, I don't like the taste of water. I drink only sodas. And I said, wow, that was really a shocking. And it's like he just came like 2 days ago and he was asking about ANF, and I said, it won't work. I said, I won't take a risk of putting it on you. So,
Yeah. So
I do believe that there is, go ahead.
If it doesn't work, that means they're not compliant with the therapy.
Yes, definitely. I will not blame any medicine or any device or any treatment tool if the patient is not complying with that device or so. Then it's not going to work for him. There is a say in the US. By the way, I live in the US, but I work in Saudi. So there is a say in the US that you can take a horse to the water, but you cannot make him drink. So really, we cannot make people to improve. We can help them to improve if they will.
Agree. Especially because those type of conditions, they didn't appear overnight. It took years of poor lifestyle to develop.
That's true. And as we know that chronic and slow inflammation, it could happen from an injury 10 years ago. So now it's actually showing the symptoms, in somewhere in the body. So yes, definitely we have to take a thorough history, and we have to palpate every inch of that patient, and we have to draw a nice picture before we can put a device on the patient. It's not sticking a device on a patient to treat the patient. It's actually a whole, operation of evaluation, palpation, and then a treatment.
Is there something that you would like to say to those that didn't join ANF education yet, but they're thinking of it?
So I do believe if anybody who is willing to learn and wants to improve, they will never deny joining or refuse to join the ANF Academy. If somebody is busy, then they have their own reasons. I do believe that just from my patients, I treat a lot of medical doctors in my clinic, and a lot of them actually, some of them joined and some of them are going to join very soon. And this is actually, I think you have 2 or 3 of the doctors that I have sent to you, but there is one, the guy with the frozen shoulder, he took actually the mastery course, I sent it to him, and he's going to join. The same patient that I presented in the video for you. The guy is a consultant, family physician. He does not really need any more education, if you will tell me about money and whatever, but he is so interested. I helped him, I helped his wife, his mom, his sister, and so forth. So when he saw the results, he said, I think I wasted so much time in my life not learning ANF. Let me not say it, not learning anything in medicine, but he said it this way. He said, I wish they will teach it in medical schools. So I do believe that the level of details and detailed learning that you learn in ANF, it's never found anywhere. See, I'm talking to you after all of these years of experience, and so many colleges in the US, and so I never learned so much details of evaluation and so much details of palpation that I have learned in ANF in a very short time compared to the other years of study.
Thank you. Thank you for this interview.
Well, this is actually I think the fair say to the academy. I do encourage every single medical practitioner who is serious to help their patients to join ANF and to learn how to take care of those patients.